So hello everyone, and welcome to our webinar. Thank you all for joining us from different parts of the world. And my name is Kaori Hirouchi, Executive Director of Africa Japan Forum, and I'm moderating this webinar today. So in this webinar, we are so delighted to present our recently released report. The title is Survey Report on Japan's Bilateral Assistance for Health in Africa. It is based on the survey carried out by Africa Japan Forum, together with RAME, Network for Accessing Essential Medicines, and ENASO, Eastern Africa National Networks of AIDS and Health Service Organizations. And it is grateful to have an opportunity to review Japan's bilateral assistance for health in this occasion of TICAD8 side event. The full report is available from the website. We will post the link in the chat box. And French version will be available shortly, but not yet, so we apologize for the delay. English and Japanese version is available. Okay, so now let me go over today's agenda very quickly. First, a summary of the report will be presented by Takakiyo Koizumi, Africa Japan Forum, followed by presentations from our research partners, Ms. Ida Yugabale Sabadoko of RAME, and Mr. Onesimus Mulewa Kalama of ENASO. Then we hear from two organizations, Mr. Mohamed Yahya of Grove, Mauritania, and Ms. Cecilia Senu of Hope for Future Generations. She's based in Ghana. Then we will have comments from Ms. Rosemary Bulu, UHC advocate of Waki Health. And in the latter part of the webinar, we have a panel discussion with all these speakers, facilitated by Masaki Inaba of Africa Japan Forum. So before starting the webinar, I would like to go over a few items on this. First, a recorded version of this webinar will be available later, so please do not record on your own. And second, simultaneous interpretation for French and Japanese is provided in this webinar. Basically, this webinar will be held in English. So we will not use English channel, only French channel and Japanese channel. And if you want to listen to in English, then please put it as original sound. So if you prefer listening to interpretation, please click the earth mark in the control panel, and you can choose your own language. We also welcome questions to speakers. You will find Q&A box in the control panel, and you may send your questions at any time during the presentation. So please indicate to whom your question goes to, because we have many speakers today. And questions will be addressed during the panel discussion. However, we may not be able to cover all the questions due to time constraints. We will try best, but I appreciate your understanding. And chat box is only available to communicate with host to address any technical or operational troubles. So please use Q&A box for questions to speakers. So I hope all are clear now. And let me introduce the first speaker. Please turn on your video. Okay, thank you. And Takakiyo Koizumi, the Global Health Program Coordinator of Africa Japan Forum. And he is one of the main authors of the report. So please, over to you.
Thank you, Kaori-san. I'm Takakiyo Koizumi. They call me Taka. Very nice to talk to you. So let me share my presentation. Can you see?
Yes.
Okay.
This is perfect.
Thank you very much. So is the community there? This is our main concern about Japanese development assistance for health sector in Africa. So first of all, let me introduce Africa-Japan Forum, AJF, and how it has become active regarding the global health. AJF was established in 1994 by the individuals who had worked together to raise voices on the importance of grassroots activities at the first Tokyo International Conference on African Development, TICAD8. AJF has purpose to build relationships with the people in Africa, expanding networks with individuals and organizations to tackle the challenges African people face. In 2000, HIV/AIDS hit Africa, causing tremendous damages. The treatment was already established at that time. However, due to the pharmaceutical monopoly, the cost was not so affordable for many people in Africa. AJF joined the global movement on behalf of equity in access to medical treatment. Since then, we have enhanced the scope of activities covering HIV/AIDS, TB, malaria, universal health coverage, COVID-19 pandemic, etc. Today, AJF is leading the advocacy for global health issues with civil societies around the world. The government in Japan is also active in the global health issue. The idea of creating global fund to fight AIDS, tuberculosis, and malaria was initiated when G7 summit was carried out in Okinawa in 2000. In 2010s, Japan has contributed to mainstream universal health coverage, UHC. UHC means that all individuals and communities receive the health service they need without suffering financial hardship. Currently, WHO website mentions Japan as a champion for health and well-being at all ages. But Japan, champion of global health? I don't argue whether Japan deserves that title. Honestly, I would like to support its efforts, as AJF always highly appreciates the value of grassroots initiatives and the essential role of communities. We decided to launch a survey about how Japanese official assistance for health is viewed by community health workers in Africa. They are working in the front line and should be natural allies with Japanese endeavor for achievement of UHC in Africa. So we, AJF, invited 2 continental networks to cover NGOs and CSOs who are working in community health in Africa. RAME for Francophone Africa, and YANASO for Anglophone and Russophone Africa. In order to make our research completer and more balanced one, we also asked CISEM to participate in this research. CISEM stands for Civil Society Engagement Mechanism, CISEM of UHC 2030, the international coordination mechanism of civil societies to promote universal health coverage. So, who participated in this research? From April to June 2022, we conducted a questionnaire survey and a series of interviews. We received in total 105 respondents from 31 countries. After that, we selected 10 people from 10 countries and interview them all. The questions are information about respondent organization, knowledge of Japanese ODA, experience and assessment of Japanese DAH, comparison of Japan with other aid agencies, experience and assessment of the Global Fund, policy recommendations on Japanese DAH. Here, DAH stands for Development Assistance for Health. Now, let's see some of their answers. First, we analyze how familiar our respondents are with Japanese ODA in general. Our first question was, have you seen, heard, or used anything about Japanese ODA in your country? Most of the respondents say yes. 75% recognize the presence of Japanese ODA in their respective countries, such as school, bridges, roads, hospitals, mainly infrastructure and equipment. Now, let's focus on Japanese DAH, Development Assistance for Health Sector. The question is, do you know of any facilities or equipment provided in your country through Japanese DAH? 37.1% of respondents say yes. Relatively high, but the figure is a little bit less than half of people who recognize Japanese ODA in general, which was 75%. The second question, are you aware of the health system established by Japanese DAH in your country? Only 20% are aware of the health system established through Japanese assistance, much lower than facility and infrastructure. One respondent says, without having more details, I only see the JICA logo on the installations. Another question, are you aware of any training courses conducted by the Japanese DAH in your country? The answer is much lower. Only 13.3% of respondents are aware of training courses offered by Japanese assistance. One respondent said, I know some, but they are not inclusive and actually too selective. Another question, have you met JICA volunteers for DAH who have been sent to your country? Only 12.4% have met JICA volunteers. Now, let's see direct experience for the respondents with Japanese assistance. The first question in this sector is, have you created a healthcare project proposal and sought Japanese assistance? Only 14.3% have requested Japanese assistance for their project proposals. The second question about direct involvement with Japanese assistance is, have you implemented a healthcare project through Japanese assistance? So less than 8% say yes. Now, we are going to see how the respondents evaluate Japanese assistance for health sector. First question is, how accessible is Japanese DAH? We are using here 5-point scale. Point 1 is inaccessible. Point 5 is accessible. In the point 1, we see 36 respondents. And in the point 2, 28 respondents. 36 plus 28 equals 64. It means that more than 60% consider the Japanese assistance is simply inaccessible or difficult to access. On the other side, only 3 respondents say it is accessible, which is less than 3%. Other question is, how usable is Japanese DAH? The point 1 is unusable. There are 37 respondents here. Adding 15 respondents for the point 2, there are 52 respondents, considering that Japanese assistance is difficult to use. This is a little bit less than 50%, but be careful and please pay attention to the point 3. In the point 3, we find 31 respondents here. It is relatively high. Why? Quite a few respondents say, I have no idea. It means that many respondents choose the point 3 because they have no idea about Japanese assistance. In this survey, we received many messages and advice from respondents who are working directly for the community-level health programs. Analyzing all answers, I have come to grasp the common and main message, which is, if the government of Japan intends to enhance the impact of Japanese DAH in Africa, you need more interaction, dialogue, and stronger links with civil society organizations at the grassroots level. So let's read out some comments from our respondents. Japan should increase community-focused aid so that it can be more community-centered. From Kenya. To further improve and strengthen Japanese DAH, we need to ensure that community and civil society groups are involved, at least as observers, from design through to implementation, monitoring, and evaluation. From Ethiopia. I would recommend creating a funding mechanism for small organizations. You'll be surprised to see good projects with big impacts. From Cameroon. Japan should go beyond working with the central government and work directly with civil society organizations for endogenous development and resilient health systems of communities. From Democratic Republic of Congo. I feel that the message is crystal clear. They are also questioning Japanese DAH. Is community there? After having studied the outcome of this survey, we have created a series of concrete proposals for the decision makers of Japanese official development assistance to materialize the message from African communities. In the short term, the easiest and most feasible way is simply increase financial contribution to international organizations that can fund local civil society. The Global Fund to fight HIV/AIDS, TB, and malaria might be a good candidate because it directly supports health programs at community level. The government of Japan might also create new mechanisms for dialogue and collaboration, financial contribution, and technical cooperation at community level. It may face some difficulties to achieve because it requires the reforms of current system, Therefore, we consider this a longer-term solution. Hereafter, we will see what kind of reforms we need to improve Japanese bilateral assistance at community level. Currently, the grant assistance for grassroots human security projects is the only window for Japanese ODA to invest directly in local civil society organizations. The following reforms are necessary. 1. Accepts actively not only hardware or infrastructure development projects, but also the ones with so-called soft components. 2. Create briefing opportunities to local civil society organizations on the grant scheme and hold regular dialogues with the local level CSO and NGOs on the operational plan regarding the health issue. And 3, increase the total budget of this aid scheme and use it 20% to establish a strategic funding channel to enable strategic investment in specific issues in multiple countries and sectors. One of the channels could be supporting civil society initiatives for health to make strategic financial support available to local civil society organizations. Another possibility is through NGO partnership project, which directly supports Japanese NGOs. Japanese NGOs may work with their local counterparts through this scheme. If they can cover the local counterparts' general administration costs, the local NGOs may work more closely with Japanese assistance. And JICA, Japan International Cooperation Agency, one of the most important institutions of Japanese government for ODA. Actually, from 1997 to 2003, JICA had a development welfare support project to offer assistance to local civil society organizations, but not anymore. So JICA may revive it. Last May, the government Japan launched the new global health strategy, which makes stress on the importance of UHC, universal health coverage. If JICA is going to revive development welfare project, a certain portion might be dedicated to supporting local civil society organizations working at a community level to realize leave no one behind UHC. In its technical cooperation program, JICA is also required to consult closely with local civil society organizations from the project formulation stage to the implementation phase. Many respondents to this survey suggested that Japan should actively link its bilateral aid with a global fund. One of them says, why not take inspiration from the global fund, which works with civil society and communities, not just central government. Bilateral set aside is the use of a portion of bilateral aid to formulate and implement global fund projects. Another respondent says Japanese aid should establish technical assistance facilities that communities can have access in order to maximize the impact of global fund funding, such as Germany's Backup Health and France's initiative. Germany's Backup Health, France's initiative, formerly known as the 5% Initiative, and US PEPFAR community grants are some examples of so-called bilateral set-aside. Those countries are using some portion of their respective bilateral assistance to maximize the impact of their multilateral assistance contribution to global fund. Japan may do the same. The advantage of this system facilitates more active dialogue with civil society organizations through global fund projects, such as Resilient and Sustainable Systems for Health, RSSH, and Social Determinants of Health, SDH, etc. We have discussed with African civil society organizations working at community level for health issues. The common understanding among us, YANASO, RAME, and AJF, is that the government in Japan should have more interaction, dialogue, and strong links with civil society organizations at the grassroots level. If Japan intends to contribute, no one left behind, UHC. Now we are going to listen to our African colleagues. Thank you very much for your kind attention. Back to you, Kaori-san.
Okay, thank you. Thank you very much for sharing the detailed description of the report. Okay, so for those who joined this seminar now, we welcome, and you can ask questions in Q&A box you can find in the control panel. If you would like to communicate with host organizations, please use chat box. But for questions to speakers, please use Q&A box. And now I would like to welcome the next speaker, Ms. Ida Yugabale Sabadogo from Burkina Faso. Ida-san, she's there? Yes. She works for RAME as the coordinator of the Global Fund Francophone Africa regional platform. So please start your presentation. Yes.
Okay. Thank you, Kaori.
Thank you.
Okay. So I will try to present you briefly what is RAME and what is the Francophone Africa Regional Platform before coming to the proposition. We have few propositions to improve Japan development assistance for health in Africa. What is RAME? RAME is a civil society organization based in Burkina Faso. It has been recognized in 25 September 2003. And the mission of RAME is to influence policy for health for all the people, and to put in place some strategy. We have some strategy to attain our mission. And among those, we have a community-led monitoring system that is called UHC. That is present in 3 countries, in Burkina Faso, in Niger, and in Guinea. We also have what we call alternatives, that is to see how to find solutions to dysfunctionings that we found in health centers to enable people to have a better health services. We also do advocacy among stakeholders and capacity building for civil society organizations. What is the Francophone Africa Regional Platform? For those who do not know very well the platforms, it said that Global Fund, in order to strengthen civil society and community engagement at the level of the Global Fund processes, they put in place what they call Special Initiative on Community Rights and Gender. That is between 2014 and 2016. And after this period, this special initiative become Community Rights and Gender Strategic Initiative. This is for the period of 2017 to 2023. And this strategic initiative have 3 components. The first one is the provision of short-term peer-to-peer civil society technical assistances. The second component concerns the long-term capacity building of organizations and networks of key and vulnerable population. And the last one, the regional communication and coordination platforms. In the world, we have 6 platforms that is placed in 6 regions. And we at RAME, we are holding the the Francophone Africa regional platform. And in Africa, we have 3 one, the Anglophone Africa platform and the MENA, Middle Orient and North Africa platform. So with Ulema will show you later the Anglophone Africa platform. What are the areas of intervention of the Francophone Africa platform? We are in 23 countries, mainly based in West and Central Africa, including Madagascar. What are the objectives of the platform? It is to promote meaningful participation of community groups and civil society in global fund processes, to strengthen civil society and community engagement in responses, to improve access to technical assistance for community groups and civil society, and to support strategic community and civil society capacity building initiatives. So the platform is concern only communities and civil society members mainly. And we are doing some activities under the ground, like information on the technical assistance offer, translation of documents into French, assessment of civil society technical assistance needs, and assessment of quality of technical assistance through some studies we are doing, and also assessment of the quality of a civil society involvement. And among this questionnaires is among our activities that we are doing in the platform to see the quality of the civil society involvement, also the quality of technical assistance of Japan health assistance in Africa. What we found during the questionnaire said that, as TICAD showed just now, we receive response specifically from Francophone Africa. We receive 69 responses, and from more than 10 countries among Francophone Africa. And among these, 75.4% of them said that they heard about Japanese bilateral assistance. And school and hospital building are the most Japanese assistance they hear about. And only 85.5% of those surveyed didn't have organizational or personal experience with Japanese assistance. This is so high in our context, so that it means that Francophone people do not really know Japanese assistance. They do not really work with in the context of Japanese assistance. 82.6% never know any health system program realized by Japan. So we see that Japan doesn't communicate a lot in our context, so that people don't know really what they are doing in the ground. We also found that 87% never met Japanese volunteer. We see that TICAD speak about JICA, that Japanese volunteer, that Japan International Cooperation Agency, that is in our countries, and many people do not never meet their volunteer in our country. And 91.3% never implement Japan projects. Nevertheless, we see that as Japan participates in the Global Fund financing, 86.5% have positive experience with the Global Fund. That is by indirectly, they know Global Fund so that they know that Japan participates also in the Global Fund. 76.8% implement a Global Fund project. So through the Global Fund, through the participation of Japan to the Global Fund grants, people have some positive experience with the Global Fund, and they implement the Global Fund project through Japan through the Global Fund project. What can Japan do to improve cooperation in Africa? These are some few propositions we selected. We see that TACA already make all the summary of the proposition of people. We, from the Francophone Africa platform, we propose Japan to set up more projects on civil society and communities, because we see that the project that are implemented is mostly turned toward the government, not for the communities, so that communities really don't have direct benefits from the Japan financing. So it will be interesting for Japan through the proposition that we heard from to put in place in the countries, Africa countries, some projects mainly directed towards civil society and communities. We also propose Japan to use some more call of proposition in health domain, civil society and communities, like the other partners who sometimes do some call of proposition towards our communities. And it will be interesting to have Japan propositions also. Also, call Japan to increase its contribution to the Global Fund. We are running toward the replenishment of the Global Fund that should be held in September. And it is a great opportunity to call Japan government to increase their contribution to the Global Fund, as it is also one mechanism, one big mechanism in the world for Japan to participate in the better health of the population and communities in Africa. So that is what I want to present to you. Thank you. This is our contact. If you want to reach us, you can use this contact. Thank you very much for your attention.
Thank you very much, Ida. And you will have an opportunity to go deeper in the panel discussion. So please stay there until panel discussion, and you can turn off your video. So now, next speaker, let me welcome Onesimus Mulewa Kalama. He's the acting executive director of IANASO. Onesimus? Yes, we can see your presentation.
Thank you very much. Let me put it in presentation mode.
And you want to turn on your video?
Yes,
this is the full
I will
screen.
turn on my video.
Okay, thank you.
I hope I'm visible now.
Yes, very clear.
Thank you very much. So I think it has done a very good job explaining the work of the regional platforms, and I really would not want to get back to explaining the regional platform for Anglophone Africa, because exactly that is what we do as the Francophone Africa. But just on your screen, that is the coverage that actually IANASO covers in Africa, which are all the English-speaking African countries and some Portuguese-speaking African countries as well. But IANASO has kind of like a dual regional coverage. The red part you see is where we actually have active membership. IANASO is a membership organization, a regional membership organization with active members in the larger Eastern African region, but then our programs as the Anglophone Africa Coordinating Platform covers all the Anglophone speaking African countries. So basically, yes, that is the area of coverage that IANASO covers. So I'm simply just going to position my presentation aligned to what the survey we did, but actually providing the perspectives, the civil society perspectives on Japanese health aid in Africa. So just moving on ahead, if you look at my presentation, I've just said what do we know about Japanese aid, and looking at what civil society really understand about Japanese aid. Japan is very well much known in the health spectrum, and especially as a champion to universal health coverage. That is very much common knowledge, and many people understand this and really appreciate that Japan really spearheads universal health coverage at the global stage. It is also very well known that Japan is one of the key contributors to the Global Fund to fight HIV, TB, and malaria. So this is something that people know, that they know that, yes, Japan normally actually contributes to the Global Fund, which actually supports a lot of health programs across Africa. But again, it is also known that Japan also provides some direct aid to support improved health outcomes in Africa. This is something that's known, but as it has actually been captured very well in the evaluation, people really know much more of a development aid from Japan, especially that goes much more to infrastructure than really the health aid that actually comes to Africa. So what is it that has worked well with Japanese aid for health in Africa? Some of the key highlights that people actually really appreciate is that the government-to-government support, which is mostly the way many civil society perceive Japan aid to be, is that it has been quite efficient and strategic, because they enter into a government support arrangement, and then resources are directly directed to supporting a particular either health facility within government setups. So this has been seen as complementary and efficient. It's also localized direct interaction of Japanese volunteers to support community programs. Japan normally sends volunteers to support in health programming in specific areas. And this has also been acknowledged as something which is quite well, because with volunteers coming in to support the work of communities, that actually really helps to transfer knowledge and skills that actually communities end up to use. So that is something that is quite appreciated as well. And also the demand-driven and focus to specific need. So Japanese aid is been looked at as a government-to-government, or as they engage with Ministry of Health to provide specific needs in specific facilities. Then this is seen as quite focused and also specific to the need that is actually required in a particular area. So these are some of the things that civil society think have worked well on Japanese aid. However, what has not really worked so well is that there is quite a limited engagement of civil society and community groups in shaping the design and implementation arrangement of Japanese aid, especially health aid. And this is something that is seen not to have really worked well, as it hinges directly on sustainability issues as well, because communities are actually not really involved at the beginning of when the aid is coming in, how it's going to be implemented, like we see in other overseas development agencies support to Africa. Also, limited publicity of Japanese health aid, making it difficult for people to know when and where the aid is directed. There is really not a lot of publicity of Japanese health aid, as opposed to what we are seeing with PEPFAR, USAID, the Global Fund, European Union, which actually really publicizes a lot about their health grants. It's rather quiet with Japanese health aid, and many people really do not know, even though it is happening. They will tell you, we don't think we really know that. And also limited space for accountability, as much of the aid is government to government. So when civil society are actually not at the center of design and implementation of the grants, then sometimes this robs the ability of civil society to actually hold the governments to account, because the details of how the grant was supposed actually to work are normally not in the hands of civil society. And this then it becomes difficult for civil society to hold governments to account the same way as civil society does within the global fund circles, where the grants are quite participatory, and you can actually easily hold the government to say, this is what was supposed to happen, and this has not happened. Also, the lack of a robust framework for sustainability of Japanese health aid because of limited inclusion of civil societies and community groups. So we feel, civil society feels that these are some of the key things that have really not worked very right. But looking forward, what actually needs to happen? Really to make a mark for Japanese aid on health in Africa, a setting up of an open country operational plan process that is inclusive of civil society could be very, very helpful. Because the moment you have actually an open process, that actually allows for civil society to characterize their priorities, put them on the table, even as we are setting different programs, then this actually opens the space for accountability. It opens the space for sustainability, because civil society at the end of the day own these projects at the community level, because they have actually been involved in the design and implementation of these programs. And also setting up of a country reference group that works to set priorities for inclusion in Japanese health aid at the planning stage. This is quite critical. And we have seen this work very well, for instance, in Global Fund, where Global Fund has a country coordinating mechanism that is inclusive of civil society and communities. And this structure helps actually to bring priorities of civil societies on board. So setting up of a similar mechanism, it may not take the form of a CCM like the Global Fund, but some kind of a reference group that actually is consulted, that actually is getting involved in the design and decision making of Japanese health aid could be very, very helpful. So I know for the sake of time, I would want to take those few minutes to do the civil society perspective on Japanese health aid. And thank you very much for listening to me. I will be around to respond to any questions, should there be any. Thank you.
Thank you very much, Onesimus, for very in-depth input. And from here, now I would like to point out that we will have English and
お伝えをしておきたいんですけれども、
sorry,
失礼いたしました。
ですね、ジャパニーズ、日本語は戻していただいていいですか？で、we will have French and English. It's consecutive translation between French and English. And for Japanese, we will continue to have simultaneous interpretation. So, Some, are you there?
Oui, je suis là.
Thank you. So from here, we will have consecutive interpretation between French and English. So now we hear from two organizations who joined our survey.
Alors, nous allons maintenant écouter deux organisations qui ont participé à notre enquête.
The first speaker is Mr. Mohamed Yafia, President of GLOW.
Le premier intervenant, c'est M. Mohamed, président du GLOW.
He's from Mauritania.
Et il est de la Mauritanie.
So, Mr. Yafia, would you turn on your video?
Alors, M. Yahya, vous pouvez activer votre caméra.
Ok, bonjour.
Hello.
Bonjour.
Hello.
Yes,
Bonjour.
Could you turn on your video?
Est-ce que vous pouvez activer votre caméra, M. Yahya?
Je suis en train de l'activer.
Activating my camera.
Yes.
Allô?
Yes. Can you turn on the video?
On ne voit pas, la caméra n'est pas encore activée.
D'accord. C'est bon?
Et ce n'est pas encore bon. It's asking if it is okay. But...
Not yet.
Allô? C'est bon?
Non,
okay.
ok,
Yes,
maintenant
yes.
oui. Maintenant.
Thank you very
Maintenant,
much.
c'est bon. Merci beaucoup.
Bonjour, bonjour, merci beaucoup. Donc, je m'excuse, moi, je n'avais pas
Hello
préparé.
and thanks a lot.
Je n'avais pas
So
préparé
sorry because I didn't.
une communication écrite, malheureusement, ça n'était pas dans le,
So sorry I
dans le
didn't
programme.
prepare the written communication.
Mais je vais plutôt un peu parler de ce que je devais en parler. Moi, je félicite ce processus-là.
Ok, Monsieur Yaya,
Oui.
Il s'agit d'interprétation consécutive, donc vous dites quelque chose et vous marquez une pause pour que j'interprète pour les anglophones. Voilà, juste un peu et j'interprète, un peu j'interprète.
D'accord, merci donc. Je dis que je m'excuse de ne pas avoir préparé une note écrite.
Okay, he's sorry for having not prepared a written note.
Seulement, je vais quand même faire des recommandations, éventuellement faire quelques observations par rapport au processus de façon générale.
But he will formulate some observation or recommendation about the process in general.
C'est une initiative louable qui certainement doit déboucher sur des améliorations de l'aide japonais, de la collaboration du Japon avec la société civile africaine pour améliorer l'accès des populations vulnérables à une couverture sanitaire universelle améliorée.
So it's a process, a good initiative that can help improve Japan aid, improve the collaboration between Japan and civil society organizations in Africa, and also help also advance the university health coverage.
Nous, en Mauritanie, nous représentons deux instances. Une instance de la société civile, un réseau de la société civile qui intervient sur 15 régions du pays et qui est actif globalement sur la tuberculose, le paludisme et le VIH/SIDA.
Okay, so they represent two branches. So first CSO size where they cover 15 regions and very active on AIDS, HIV/AIDS, malaria and tuberculosis. And then the second branch.
Nous faisons partie de représentants de la société civile au sein du mécanisme du Fonds mondial, le CCCM, c'est-à-dire le comité de coordination multisectorielle de lutte contre le sida, la tuberculose et le paludisme.
And the second branch is that they are also the representative of CSOs in the CCM mechanism, Global Fund CCM.
À travers ce mécanisme, nous travaillons sur la préparation des demandes de proposition, c'est-à-dire des demandes de financement auprès du Fonds mondial.
So through CCM, they contribute to the developments of funding requests through CCM.
Seulement, nous constatons malheureusement que nous participons à des travaux, nous faisons des propositions, mais nous constatons malheureusement que le Fonds mondial actuellement, en fin de compte, il traite avec le gouvernement et généralement, nos propositions sont biffées, sont supprimées à la dernière minute. Et par conséquent, les demandes que nous formulons pour améliorer l'accès des malades aux soins restent toujours très faibles en deçà des besoins vraiment réels.
So unfortunately, they contribute to the developments of the demand for funding for Global Fund, but unfortunately, their contribution do not actually reach the final stage because what they notice is at a certain level of the process, Global Fund work directly with governments, and some of their recommendation for CSOs do not reach to the final draft, final application that is sent to Global Fund.
Dans le chapitre de proposition, je vais plutôt aller vers le chapitre de proposition, puisque ça, c'est ce qui nous semble être bon, à la fois pour améliorer l'aide du Japon et pour améliorer la santé en Afrique. Moi, je pense que nous travaillons, nous, actuellement en Mauritanie, sur la question de l'assurance maladie communautaire. C'est-à-dire qu'on essaye de mettre en place un mécanisme d'assurance communautaire des malades, puisque l'État ne peut pas prendre en charge tout et parfois les services des structures de santé sont très éloignés et les besoins de transport, d'accès des malades. Donc, nous travaillons sur un système d'assurance maladie communautaire. Et je pense que l'aide japonais doit mettre en priorité cette question au niveau de son programme futur pour l'Afrique.
So he said he would then prefer going to recommendation because she think this is what can help the Japan bilateral help and also helps in Africa. And one of his recommendation is putting in place a community health assurance mechanism because what happened is that communities at the local level have no do not have access to health services because of some challenges, and government are also not able to provide the different need to help them have access to health services. So he thinks that if the Japan bilateral help can focus on creating those mechanisms at the community level, it can be of a great contribution for their help and also for communities.
Je fais une deuxième proposition par rapport à la collaboration à cette aide, c'est-à-dire que le Japon peut aujourd'hui instituer un mécanisme qui est accessible directement par les organisations communautaires d'Afrique, c'est-à-dire mettre en relation peut-être, créer un fonds que les ONG africaines peuvent accéder, certainement à travers une collaboration avec les ONG japonaises ou à travers, je ne sais pas, le mécanisme d'aide à la santé. Donc, je crois que c'est une perspective qui peut être à la fois accessible directement par les organisations africaines, mais en même temps renforcer l'accès des populations aux soins de santé de qualité.
So the second recommendation is to maybe find a way for like a mechanism for a direct access of CSOs to Japan Fund. Like he said, as he said, it could be the creation of a fund for CSOs in Africa, and that can be an opportunity for CSOs to collaborate with Japan NGOs, and they can also create like a sort of collaboration. I didn't get the last, but la dernière partie, je n'avais pas pu mentionner, c'est-à-dire la collaboration pourrait, ça pourrait être le fonds ou voilà.
L'aide japonaise peut créer une fenêtre ou un fonds, ou je ne sais pas quoi, un mécanisme de financement qui soit accessible directement par les ONG africaines, soit directement au niveau de ce fonds, ou soit via les ONG japonaises qui sont actives dans le domaine de la santé et qui veulent se mettre en contact avec les ONG africaines afin qu'on garantisse la redevabilité, la transparence de cette question.
All right, so the idea is first having like a fund for African CSOs, like civil society organization. And there are two ways that this can be done. First, create a fund that is directly accessible to African CSOs, or create a fund that can be accessed through NGOs of Japan's that are also intervening in Africa. And this will allow the creation of, allow questions of redevability, like we can create transparency in a certain way and help for good management of those for that fund.
Sur le troisième aspect, sur la troisième proposition, je voudrais aussi demander au Japon, comme un grand pays de financement du fonds, de voir quelles sont les conditions qu'il doit soumettre son aide au niveau du fonds mondial de lutte contre le sida, la tuberculose et la paralysie. Puisque jusqu'à présent, ces fonds, ou au moins pour la Mauritanie ou pour les pays que je connais, ne sont pas accessibles directement par les ONG. Et généralement aussi, les demandes de financement qui sont formulées, la prise en compte des aspects communautaires sont assez faibles dans ce financement. Donc, je pense que le Japon peut encore améliorer le fonctionnement du Fonds mondial pour que l'accessibilité des ONG et des communautés puisse être assurée.
And as Japan is one of the big contributors to global funds, he thinks that Japan can also see their condition for that contribution to global fund in a way that the fund actually can be accessible to CSOs working on HIV. Because what he noticed is that in the request process, some of the recommendation or priorities of CSOs at the country level doesn't reach the final draft. So the condition can help those priorities reach the final submission and then help CSOs have access to the fund.
Voilà globalement ce que je voudrais dire. Je remercie quand même l'équipe de l'ensemble du monde qui a participé à ce processus. J'invite par cette occasion les ONG japonaises à se mettre en contact avec nous pour qu'on puisse faire avancer ensemble la santé mondiale et la santé des populations en Afrique. Je remercie celles ou celles qui ont participé à ce processus-là et qui veulent le continuer avec nous. Merci.
So he thanks all those who participated in this meeting, and this is what he wanted to say in general. And he invites Japan NGOs that would like to work with CSOs in Africa to contact African CSOs for that. Thanks.
Thank you very much, Yafia.
Merci. Thank you.
Thank you. And you can turn off your video until panel discussion. Would you translate, Some? Some? Some, can you translate?
Mais tu es là. Aya, est-ce que tu peux fermer ta caméra maintenant?
Oui. Merci.
Merci.
Thank you. Thank you, Ida. Okay, sorry for some confusions on translation. From here, French speakers, you can use simultaneous translation. I wonder, maybe somebody wants to translate this into French.
Kaori dit que les francophones, vous pouvez utiliser la traduction simultanée en français d'ici. Is it from this channel or the channel, French channel?
French channel. 梶谷さん、
Okay.
フランス語を戻してもらっていいですか？染さんを同時通訳の方に。
Vous pouvez utiliser le channel français,
Yeah, sorry, I'm
interprétation pour suivre. Merci.
asking operator to go back to French channel.
はい、
梶谷戻
してます。
どうしました？はい、ありがとうございます。Thank you very much. So we can start again. Thank you very much, Yafia, again. So now I would like to hand it over to our next speaker, Ms. Cecilia Senu. Cecilia? Yes. She is the executive director of Hope for Future Generations and based in Ghana. So Cecilia, thank you and feel free to start.
Thank you very much. I also thank all colleagues, previous speakers, for this opportunity. My name is Cecilia, as already indicated. I work with Hope for Future Generations. I'm a member of GFAN Africa and also a focal person for IANASO in Ghana. I work with other regional networks and very active in the civil society sector. So Hope for Future Generations was established in 2001 as a national community-based women, youth, and children-focused organization. Our interventions have already touched over 10 to 15 million people in this country. We are very active in the health sector. And so, as already indicated, we've been very active in the health sector. And I also indicated that we work closely with communities ensuring strengthening community systems, community structures to support interventions. So all the previous speakers have already spoken about Japanese aid to Africa. And I just want to emphasize that in Ghana, when you look at all that Japanese aid has done with government is quite huge, and it is very, very visible. And so it is time that Japan starts looking at civil society. Our work in communities as civil society organization, which is not different from all other civil society organizations, is mobilizing communities, strengthening their capacity, creating demand to participate actively in various interventions. And so if this is what we do, what civil society needs to support all these interventions is capacity and resources. I want to indicate that the Japanese aid, from the research and the presentation from Ianaso and Ida Mlewa, it is clear that civil society and many community-based organizations only know that Japanese aid support government. It's more bilateral than support to civil society organizations. I gave an example of a number of things we do in the health sector. For example, when it comes to maternal, neonatal, and child health organization interventions, civil society actively provide innovative education using very acceptable and sustainable interventions and strategies to ensure that communities, women in their reproductive health, young people, accept and participate, and that is what we do as an organization too. One of the important things that I want to recommend is that partnership with government, civil society, bilateral intervention will go a long way to provide positive health outcomes, especially. For example, when it comes to maternal, neonatal, and child health interventions, I know a lot of Japanese aids go to government to reduce maternal, neonatal, and child health. But one thing that will work very well if Japanese aid can start supporting civil society is creating sustainable resources through our regional networks. For example, if GFAN Africa is resourced, because GFAN Africa works a lot with civil society organizations across Africa, then it can be a structure that resources can pass through. If it is in NASO, they also have their structure. If it is CS for me, maybe one of the things that we can start looking at, these are my recommendations, is that to ensure that civil society strengthen and sustain community level interventions, it is important that we invest adequately and sustainably in these regional networks that we are all part of, especially in Africa and Asia. Another thing that we are looking at, and which I will recommend looking at the survey results, is that, you know, civil society and communities are grassroots organizations. We are directly in touch with the communities, and we speak the local language. We speak what the communities hear, and we understand. We live with them in the communities. It is important that donors like JICA, Japanese aid, start reaching civil society organizations to be
Cecilia? I think web condition is not good. Let's see. Let us wait. Okay, you're back.
I'm back.
Yes, thank you.
Thank you very much. I'm looking at the recommendation that investing adequately and strengthening capacity of civil society organizations is one of the key areas that Japanese aid can start looking at, because the research, the survey you conducted is clear that limited resources reach civil society and community groups. In Ghana, you can count the number of civil society organizations that benefit from Japanese aid or JICA interventions. They are very limited, and it is focused on in one area. I gave an example of my organization benefiting from an intervention which supports shea butter production. But it is unsustainable after that, nothing. And so it's very limited civil society organizations benefit from Japanese aid. And I think it is time Japanese aid start reaching civil society organizations. Yes, we agree that you are one of the major supporters of the Global Fund, and the Global Fund is supporting many of us, communities, TB, HIV, and malaria. But Global Fund resources to civil society is limited because there are so many organizations that are benefiting from Global Fund. And so your support to Global Fund and other national and regional networks will reach more community and civil society organizations. I also indicated, and I want to share that in our interventions with support of JICA, child and neonatal mortality has reduced drastically in Ghana. For example, Japan supports grassroots government and health facilities in the hard-to-reach communities. And those hard-to-reach communities have very limited access to health. But Japanese aid or JICA provide those innovative strategies and support and resources to those people through government structures. And we believe that if Japanese aid or JICA can start reaching out to small civil society organizations who are mostly working in those hard-to-reach communities, mobilizing disadvantaged and underserved population, it will go a long way to show results and contribute to the positive health outcomes and the national goal and civil society goals in Africa, as we are talking about. I think one of the recommendations that I talk about is also looking at transfer of skills and transfer of knowledge through the Japanese NGOs, who are also our colleagues. Because we speak one language, it is very important and it is very useful to ensure that civil society and these organizations in the continent, Japan international organizations, local NGOs, and then African NGOs can share skills, can share knowledge, and even share technology. Because, I mean, Japan is a developed country. Africa, most of the African countries are developing, and few of them are middle income countries. And so that means that with adequate resources, investment in skills of civil society in Africa, and transfer of knowledge, learning from each other will go a long way to change the worldview and then intervention of civil society in Africa. Another important thing that we want to recommend is to ensure that civil society benefit from very, very important training, educational exchange, and also to ensure that logistic support to civil society in Africa is regular and sustainable. And this can be supported through Japanese aid as they continue investing in our government, especially Ministry of Health and national governments, to build our country. And finally, interventions that address gender, interventions that support education, and integrating stronger partnerships with government to see civil society as one of the strongest partners that government can work with, and ensuring that community volunteers, community system strengthening, align directly with civil society focus and civil society goals and civil society vision. And for that matter, GFAN Africa, CS for me, EANASO. I believe with these interventions, Japan aid will be very visible, it will be sustainable, and it will remain to build very active, viable, strong civil society in Africa that will work closely with government and make sure that government address and invest a lot in the resources that Japan government brings to Ghana. And I just want to end my presentation here to thank you for the opportunity and just to say that this is the time to strengthen civil society partnership between Japan and Africa. Thank you very much. I'm available for questions and additions.
Thank you very much, Cecilia. And before moving on to the next speaker, I would like to mention that if your contribution from the participants is really appreciated. And if you have comments and questions, please use Q&A box so that all the participants can read your message. If you use chat box, only host and panelists can see the message. So if you have trouble with operational or some technical problems, or you have message to host organizations, you can use chat box. But if you have something to speakers, if you have a comment from on the presentation, please use Q&A box. And your contribution is really appreciated. Thank you. Okay, now let me invite the last speaker, Ms. Rosemary Mbulu. She's the Executive Director of Uhc Health for comments. Rosemary, please begin.
Yeah, thank you. Good afternoon, good morning, dear colleagues and partners. As I've been introduced, I'm Rosemary Mbulu. I lead the team at Uhc Health. I'm based in Nairobi. And in addition to that, we co-host the Civil Society Engagement Mechanism for UHC 2030 together with MSH, and very happy to have partnered on the survey, the research that was led by Ianaso and Ramen. But also we lead on GFAN Africa and other community and civil society platforms, but wanted to mention those as they have been mentioned here in this meeting. So my task here is to reflect on universal health coverage and community systems strengthening. So in terms of UHC, I think basically in terms of reminding ourselves, it means that everyone, anyone, everywhere can access health services without suffering financial risk. So any person, think of any person anywhere in that remote village, in that inner urban area, any human being wanting to access health should access it when they want it without being pushed into poverty out of the act of seeking health. And so we have an understanding of what we are talking about. We are talking about equity. We are talking about equitable access to health services. We are talking about all people being equal. We are talking about people's dignity. When you think about community systems strengthening, we are talking about the community structures, the mechanisms, the processes, and even the actors. So bringing in people that support an array of activities or community responses that meet the health needs of people. So it's not a single activity, it's not a single structure, it's not a single mechanism. It's really a whole ecosystem of community responses that work together to ensure that all people can meet the health needs that they want to meet. And so we are thinking about community systems being part of the health systems. And so if we think about universal health coverage, if we think about the role that health systems play in ensuring that countries can make progress towards universal health coverage, then we can situate the place and the role of community systems within that. So community systems are very important in many ways, and there is so much that we need to do and to invest in. But I must first begin by saying that there is a lot of literature, there is well-documented experiences in community participation and engagement within the health sector. But I must also say that not all of them are successful. Not all of them are successful. We have also many interventions and many programs that do claim that there is community involvement, community engagement, community participation. But if you begin to scratch the surface and to interrogate the extent to which that is successful in terms of strengthening community responses, then you find that many of them have failed. What we know as communities and civil society is that there is no global health response that will ever be successful without communities, without thinking about the role of community systems, without strengthening community systems. And so if we can situate community systems at a place where, as a facilitator, as an enabler of health outcomes, of health initiatives, of programs, of processes, then we can understand that we are talking about a very critical component within the universal health coverage space. The challenge we often encounter is where you have funders, you have partners, mostly thinking that community systems are an add-on, is an afterthought. It's something you bring because it's good to have, or you bring it because there are policies and there are expectations that you will involve community. So it comes in as an add-on, as a final thought, as a final reflection. And I think we need to begin from there within universal health coverage, to begin from the premise that community systems are an integral part of countries making progress towards universal health coverage. And you cannot do without that, and you cannot be successful within that. Why is that important? I think the first thing, even as we continue to acknowledge and appreciate the role and place of community systems within universal health coverage, we also need to move away from language that is not very empowering and that does not position community systems in the high place it belongs. So when we talk about involvement and engagement and participation, we are needing to move to a language that thinks about community leadership. It's not just involvement, it's not just engagement, it's not just participation. We need to see more and more of community leadership, and we need partners, we need funders, we need the global community to embrace community leadership and to pursue that, as opposed to a one-off engagement, one-off involvement, or the language that has become, very common, but really actually means nothing. So we are moving to community leadership and saying that in the responses, we want to see more of that. And I think I'll be right to say that community leadership is a cornerstone for developing local, equitable, and integrated systems for health. And when you think about universal health coverage, we also have to understand that primary health care is the biggest entry point, towards universal health coverage. And when you think about primary health care, I think then you can have the picture of the fact that at the very bottom, at the community level, every single person is interacting with their system, is interacting with primary health care. But we also have to understand that with community systems, it's also outside of the health system. It's not necessarily within the mainstream where you go into the facility or you go into to see a doctor. They are within the mechanisms and structures. We have to appreciate the roles that communities play, actually at the community level, at the very bottom of the pyramid. Whether it's checking that your neighbor is taking their medication, whether it's checking that your neighbor is actually going for that clinic visit, whether it's ensuring that we are connecting what we are hearing on the ground and participating in the referral system. And that has a place, it has a role, and it needs to be strengthened if we are going to make progress towards universal health coverage. So it is important because when you have community structures, when you have community mechanisms, when you have community responses, you increase the uptake and quality of health services. The uptake is very important because you need the community structures, the community mechanisms to actually mobilize, to actually reach out, to actually speak in support of the intervention. I think COVID-19 is a good case in point to say that we struggled as a global community when it came to uptake of COVID-19 vaccine, for example. But we have to go back and think about what community structures, community engagement plans, community engagement mechanisms did we invest in as countries, as funders, as donors? Or did we only invest in ensuring that we have the vaccines, but did not think about how you turn the vaccines into vaccinations? And how you turn the vaccine into vaccination, you cannot do that without a community engagement plan. You cannot do that without thinking about the community structures, thinking about the people who are likely to resist and coming up with a plan on how to engage them. The second point is around advocacy and policy development. I think we have to give it to communities in terms of pushing for policies that promote equity and improve health outcomes, whether it's at the point of the national strategic planning processes or national decision-making processes. A lot of the things that communities flag are things that will most likely not be noticed if you don't include communities. We have to understand that with universal health coverage, we are talking about financial protection for individuals. We are talking about communities accessing healthcare. But we have so many instances where, unless you have communities in there shaping the policies, speaking up about populations that are being left behind, the effort is futile, because you cannot achieve universal health coverage if you have certain populations being left behind. And so it becomes also very important that we are talking about these things. We are pointing to communities that are likely to be missed by health systems. We are pointing to policies that are limiting communities' abilities to access health services. So you have an example, for example, in many of our countries, you have MDR, multi-drug resistant TB patients. So we understand and we know that for them to access the treatment is not adequate. So we need the treatment, but we also need to think about the social protection programs. These are colleagues, these are families, these are friends who cannot keep full-time employment because of the effects of the treatment. And so just thinking about treatment alone is not sufficient. And that's where we come in as communities, colleagues, civil society, to shape such policies to say treatment is important, but it is not everything that we need to ensure that there is financial protection, to ensure that individuals and communities access health services. And I think leaving no one behind, I just want to poke that a bit and amplify the role of communities within that. If universal health coverage is truly universal, then countries need to identify who their communities that are most likely to be left behind are. Unfortunately, a lot of our countries live a lie. They do not tell the truth about how certain communities are being left behind. And what that means is that when funding comes, even funding from partners like the government of Japan, it goes into investing into what countries have prioritized. And so communities that are being left behind continue to be left behind because we are not identifying, we are not outlining. We have not as a country come out to say these communities are being left behind by health systems and this is how we are prioritizing them, and communities at the ground, on the ground, can play a big role in shaping that. So what do we need to do in ensuring that we amplify or we strengthen community systems? There are many ways. First of all, partners like the government of Japan and other partners need to be proactive in investing in community systems, investing in systems that can help do all that I was explaining. We have community-led services, for example. There is a lot, and there are many places where our governments cannot reach, where the mainstream health system cannot reach. And we count and rely on community players to actually reach those places. We need services that are community-led, community-led responses, and we need those supported. You also have another big bucket of strengthening health systems, where we are talking about institutional system strengthening. All these organizations that are doing this work, this very important work, a lot of them are doing this for free. A lot of these organizations are not funded to do this. A lot of these organizations are closing every day because there is basically no financial capacity, no technical capacity. And so we also need to think about the institutional support, funding community organizations. And when you do that, that is exactly when you will actually be strengthening community systems, because people come and go. But I think we need to ensure that we are building, especially here in Africa, community organizations that can stand today, tomorrow, in future to actually provide these system services and link with the government in order to amplify the advocacy, in order to participate in policy development. I want to talk about another thing is about data. I know a few colleagues spoke about community-led monitoring, and I want to situate that within the politics of global health and why it's important that when we have funding, we are also funding community-led monitoring, community-initiated and driven monitoring, data generation. It's because there's a politics of who owns the data, where the data comes from. There's politics around that. And how that data is used determines where the priorities are identified and what gets funded. So it's important that if we think about community system strengthening, if we think about community leadership, we must also think about community-driven data. We must invest in community-led monitoring. We must ensure that we have systems that can generate the data where the mainstream monitoring or data sources are not pointing to. Then the community-led data will point to that, and that will be a sure way to ensuring that we are not leaving anyone behind, and we are prioritizing the investment. And so I think the last thing for me is to say that, you know, countries, partners, they need to continue to think about investing in the public perception and community engagement, public perception of different things and different processes. No matter what public health program or initiative you bring about, if we are not investing in public education, in how the public perceives the intervention and the program, it becomes very difficult to actually implement that on the ground. It becomes very difficult for community health workers to actually implement those programs or activities. So I think I will leave it here. That's my intervention as far as universal health coverage is concerned, with a specific focus on strengthening community systems. Thank you. Back to you.
Thank you very much, Rosemary. Very clear message and great input. So now it is time for panel discussion. So dear all the speakers, please turn on your video. I'm sure you are ready for panel discussion. And from here, Masaki Inaba, Co-Chair and Global Health Program Director of Africa-Japan Forum, will facilitate the discussion. And let's see, Cecilia, Onesimus. Yes.
Okay, thank you very much. Thank you very much for a very fruitful discussion in the symposium webinar. And we have only 20 minutes, but we need to make the fruitful panel discussion as well for the further 20 minutes. My name is Masaki Inaba. I'm the director of the Global Health Program of Africa-Japan Forum. So I would like to ask Mr. Taka and Koizumi first about the Japanese assistance for health and also the other Japanese assistance on the other fields. And you have a long career of the humanitarian assistance in the countries and the regions under armed conflicts. In the context of Japanese bilateral assistance on humanitarian issues, are there any direct investment for communities affected by conflicts and disasters? If so, what is the difference between health and humanitarian assistance? And Taka, floor is yours.
Thank you, Masaki. Yes, there is a lot of projects through Japanese bilateral assistance in countries affected by the conflicts and natural disasters. However, the most common scheme for the government of Japan to directly invest in civil society organizations is a grant assistance for grassroots human security project. So there's not much difference between humanitarian assistance and health sector project in this sense. And another important scheme for conflict-related project is Japan Platform. Japan Platform is all Japan initiative that enable Japanese NGOs to address quickly damages caused by both armed conflict and natural disasters around the world. Japanese NGOs work with local civil society organizations. This Japan Platform may indirectly invest in local NGOs. Over to you, Masaki.
Thank you very much. Yeah, and so that we need to advocate for the other fields, not only the health sectors. Yeah, thank you very much. And secondly, I would like to ask Cecilia and Yafia, and the question is that from the view of the experts working along with the community, what can communities do and have communities have been doing to save the people's lives and protect people's health? Please give the audience an example that community has been playing key roles to protect people's health. So first Cecilia and the second Yafia. And for the Francophone speakers and French speakers, and when Yafia speak, please change the translation channel to the original audio, and you can, so that you can listen to the consecutive translation from the on French. Yeah. So anyway, Cecilia first, and after that, Yafia, please.
Thank you very much for this question. Since time immemorial, communities have been there for each other. They have been the social control. They have been taking care of each other, especially in Africa. Your neighbor is your brother, your sister. Whether you are blood related or not, we already take care of each other as Africans. And so when you hear a neighbor, or when you wake up and you don't see your neighbor, you knock at her door or his door to find out what is happening. And I think that social control, social cohesion, the sense of belonging, when you talk about communities, is already clear. And so one important thing that communities have been doing is, I think Rosemary talked about basic health, primary healthcare, basic healthcare, supporting each other, communal labor, communal support. And that is what we have to do and strengthen. Because these things come naturally, we are born with it. And so from infancy, your social control already tells you that your neighbor is your relative, is your friend, and everything. And so in time of difficulties, you are not alone. We are together as Africans and as community people with civil society organizations. I think one important thing that we have to do as communities, as civil society organizations, to support each other, first is basic healthcare, strong behavior change interventions, because many interventions that continue happening in Africa is change of behavior. And we need to do a lot of communication using very strategic, innovative interventions to communicate basic health for people to prevent diseases, falling sick. And when you look at that also, we talk about nutrition or other interventions. Important thing that civil society, and one thing that civil society can do and communities can do to support each other is speaking on issues that affect them. Because if you don't speak out and we are all quiet and we are part of it, I don't think there will be a change. And finally, our government, we are all paying tax. Whatever resources come into our government or our resources, we are all part of it. I think we must really provide alternate solutions to governments to invest adequately into interventions that are sustainable, that will help us to invest more in preventive health. We don't need to wait for people to fall sick, but a lot must go into preventive health. And that is one area, and that is why many of us are calling on bilateral donors, everybody, to invest in civil society organizations so that we can communicate basic health intervention, prevention of diseases, and preventions of things that will end up making us sick, more to communities using the local languages. I know communities already have their resources. We must, as much as possible, use community-owned resources for interventions and domesticate interventions that are accepted by communities that will, and maybe basically sustainable by communities. In Ghana, for example, we use community traditional leaders, queen mothers, chiefs. Queen mothers are there forever until the queen mother dies. You will not get any other queen mother. And so for so many years, you can work with that one or two queen mothers in the communities because they form very important part of our community systems. Apart from the persons with the disease, these community structures are sustainable because they are there. And so when you invest in our queen mothers, you invest in our chiefs, you invest a lot in our young people, you invest a lot in education so that a lot of things, that behaviors that adults have formed, and you start it very early and you use these community structures, you'll be able to sustain all your interventions, and you'll be able to ensure that people follow and understand and accept whatever you are doing, and then you are forever there to support them. Thank you very much.
Okay, thank you very much, and thank you very much for the how to say, your powerful speech, but the community is powerful. Thank you very much. And Mohammed, floor is yours. And please please wait a little to make people move. Yeah. Bonjour. Yeah.
Bonjour,
Okay.
vous m'entendez?
Yes.
Bonjour. Bonjour.
Oui, on t'entend. Bonjour, Yaya, tu peux y aller.
Merci.
Donc,
Merci.
on va faire comme ce que Somain a fait tout à l'heure. Tu parles un peu, tu me laisses traduire, s'il te plaît.
D'accord, merci beaucoup. Donc, moi, je vais peut-être continuer sur la même ligne. La communauté peut jouer des rôles importants. Le premier rôle, c'est un rôle qui est spécifique aux acteurs communautaires. Comme l'a dit tout de suite Cécile, en Afrique, les cultures et les effets des cultures sur la santé sont persistants. En Mauritanie particulièrement, nous avons des taux comme on appelle dans le jargon, le perdu de vie des malades tuberculeux et des malades du sida. Pourquoi? Parce qu'ils pensent que ce sont des maladies traditionnellement considérées comme des maladies honteuses, comme des maladies à cacher, et vraiment il ne faut pas être visible comme étant un malade qui visite régulièrement les centres de dépistage, les centres de prise de traitement. Et donc, à cet aspect-là, il y a un changement. Il y a le rôle des leaders communautaires, des organisations communautaires, de la communauté tout entière, à ce qu'elles puissent vraiment changer de comportement par rapport à ces questions de maladies. Que les maladies, ce sont des maladies tout à fait naturelles, que chacun peut prendre, chacun peut attraper, et qu'il ne faut pas se cacher, qu'il faut vraiment avoir le courage de ne pas avoir la honte de cacher sa maladie et de ne pas la traiter normalement. Ça, c'est le rôle principal.
Je vais traduire, s'il vous plaît. Je vais traduire et vous allez poursuivre, sinon je ne vais pas traduire beaucoup. Okay. Yasser is making a proposition. He said that the community can do important role in the health system. First of all is community affairs. What concerns communities, we take the case of tuberculosis and HIV, where we have some people who are lost. We don't have news about them in the health center because they are we have stigmatization, and community can work in this first area. Vous pouvez continuer.
Le deuxième aspect sur lequel la communauté joue un rôle important aussi, c'est cette question de prise en charge des malades à travers le système communautaire, l'entraide communautaire, la famille, la communauté, les villages, qui sont généralement, il y a une prise en charge sociale des malades de la communauté. Et donc, dans cet aspect-là, si le renforcement des capacités de rôle des communautés, on renforce cette prise en charge communautaire, cette forme d'assurance maladie communautaire qui est aujourd'hui presque le seul pilier principal pour prendre en charge les malades dans des zones reculées où l'État est défaillant, où les structures sanitaires n'existent pas. Donc, je crois que sur cet aspect-là, le rôle des acteurs communautaires est primordial et important.
Okay. The second aspect is the healthcare of patients, and community can do a social role in this area with capacity strengthening. They can play the role of taking care of patients and taking care of people who are ill in the communities. So this role also can be done by the community health workers. Merci, monsieur Yasser.
Le troisième
Vous n'avez pas
aspect,
fini? Oui.
le troisième aspect sur lequel la communauté et le renforcement des capacités des acteurs communautaires importants, c'est la question stratégique. C'est comment prendre en charge les questions de la santé au niveau des plans de développement communautaire, des plans de développement régionaux, au niveau stratégique. Si on a des acteurs communautaires très forts, très engagés dans la planification des questions de la santé, on aura certainement une demande sociale assez importante qui va renforcer la prise en charge des questions communautaires dans la planification au niveau local et au niveau régional et national.
Okay, the last one is a strategic question, how to take into account communities in national strategic plans so that government can do capacity strengthening, help them be more proactive in the field.
Merci beaucoup.
Okay, thank you very much. Thank you very much. From the community's view for the on the health and intervention, and we have only 10 minutes, so that we need to make the question and answers very briefly. Third question is for the Onesimus and Ida, and my question is that we understand that the investment of the global fund for the community provides good practices that should be referred to by bilateral donors. You have been working as the continental platforms of the community, gender and rights initiative of the Global Fund. Can you introduce good cases of the community investment to develop successful community responses for health? First from Ida and the second from Onesimus, but please make your answer very briefly. Thank you very much.
Okay.
So first, Ida, please.
Thank you, Masaki. Okay, from the Francophone Africa Regional Platform, we made a study in 2019-2020 to see how community can take into account the Invest Health Center, how community can replace the government where we have some challenging operating environment. We did this study in 5 countries, Chad, Guinea, Mali, Niger, Central African Republic, and Niger. And I will just give one example from Mali, where we found that in Mali, community-based workers ensure distribution concerning malaria, distribution of impregnated mosquito nets, and then ensure chemoprophylaxis of complicated malaria. They also monitor children treatment. They advise on the use of impregnated mosquito nets. And concerning HIV, they take care of HIV for patients. And concerning tuberculosis, they do tuberculosis screening. So we see that community can do real work, mainly in challenging operating environment. And this is just one example. Thank you.
Okay, thank you very much for the very good example. And also, Onesimus, are you here? And can you respond for my questions?
Yes, I'm here.
Oh, great. Thank you very much.
Masaki. When you asking the question, my network was a little bit shivering. If you can just repeat it quickly.
Okay, so that I would like you to raise one example, good example of the global fund assistance for the communities in the Anglophone Africa.
Thank you very much. I think the Global Fund has really presented us with a very good mechanism, and to which civil society are actually able to meaningfully engage in the design, implementation, and monitoring of programs. And one of it is the democratically election of civil society members into the country coordinating mechanism. That has turned out to be one of the greatest model where communities actually elect their own representatives who will sit at the country coordinating mechanism to be able to influence and share priorities for civil society and shape the Global Fund grant implementation, monitoring, and its design. So that's a very good model. And in Tanzania, in the last 3 weeks, the country coordinating mechanism was actually engaging in the process of electing civil society representatives, and each of the constituencies were actually provided with a time to recruit their own representatives who are going to present the interests of the different communities, including key populations in the country coordinating mechanism. So I think that is an extremely useful model that brings ownership and sustainability of programs. As communities feel that they own the programs, they feel that they are adequately consulted, they feel that they adequately contribute priorities that shape the responses in their countries. Thank you so much, Masaki.
Okay, thank you very much. So that the Global Fund has been providing a good model of the financial and also technical assistance channel for the direct investment for the communities. Yeah, thank you very much. And finally, my last question is that to the Rosemary. My question is that you are the expert of universal health coverage as the former steering committee member of UHC 2030. What are communities' crucial existence for stronger health systems? What role communities can play to protect people's lives and health, and what investment is necessary for the communities? You have already explained in your speech, but the most important points, please show us in very brief comments. Thank you very much.
Yeah, Masaki, thank you. The most important, I think, takeaway point from me is that we need to invest in social participation of communities and civil society in national processes. So participate in national decision-making processes, such as strategic plan development processes, and invest in real-time monitoring, ensuring that communities can track and monitor whether programs are, in terms of resource investments, in terms of results, are delivering that, ensuring that they are being implemented within the human rights framework, there are gender considerations in there, and finally on accountability, ensuring that civil society and communities can play their accountability role as a watchdog so that we can deliver the results and the impact that the funding is intended for. I thank you very much.
Okay, thank you very much. So that in this panel discussion, we learned a lot from the African colleagues about the very diverse dimension of the importance of the communities and also that the community intervention for health. And so that we need to learn more as the Japanese civil society working on the health assistance and from the African communities and work together with the African colleagues. And also that we need to advocate together with the civil society in Africa for the for Japanese bilateral agencies and the governments. So that I will back to the microphone to the moderator Kaori.
Thank you very much.
Est-ce qu'on peut dire un
And-
mot? Est-ce qu'on peut dire un mot?
Sorry.
Yasia, on est un peu pris par le temps. On va vous donner la parole après, s'il vous plaît.
Ah bon,
Un
d'accord.
dernier mot. Merci.
Okay, thank you very much. And sorry for that we have only limited time. And I would like to thank all the speakers who shared their experiences and very in-depth thought. So now we are closing now. And before that, Inaba-san, would you like to wrap up and make closing remarks, maybe very briefly?
Okay, thank you very much for the chair and all the participants, and especially the African panelists of the webinar. Also, I appreciate very much for the IANASO and the LAME, the partner networks to work together for the collaborative research to review the Japanese bilateral development assistance for health from the aspects of community. We appreciate very much for the 105 African colleagues from 31 countries who responded to our questionnaire and the 10 African colleagues from 10 countries for in-depth interview. Africa-Japan Forum, RAME, and the IANASO collaboratively made this survey and our founding was that Japanese TAH development assistance for health is not visible and not accessible from the people who work for the health in the community level. We, Japan and the African civil society, all fully know that the government of Japan has been making its precious contribution for the global health, especially in policy level and its multilateral assistance, as well as public health system strengthening through the government-to-government channel. Our point is that, adding to these efforts, Japanese DAH should work together with communities in Africa through developing its own financial and technical assistance channels for the communities. It will also improve the transparency and the visibility of African civil society, as well as gaining more trust and solidarity from the communities and ordinary people of Africa. We, civil society of Japan and Africa, would like to continue evidence-based advocacy to improve Japanese DAH. We are still in early stage. We would like to call African civil society organizations to join the movement and also call Japanese government and Japanese bilateral agencies to listen to the voices of African civil society and communities and open up the pipeline of dialogue, technical and financial assistance to work together to realize health for all in Africa and everywhere. Thank you very much for participants.
Thank you very much. And I also would like to extend my appreciation to you all for being part of this seminar. And also, let me express my appreciation to interpreters, French interpreters and Japanese interpreters. At this time, the time was limited and we were not able to cover all the contributions that participants gave to us in Q&A box and comments. And I hope that we have some other opportunities to continue this discussion on this topic. So our time is up, unfortunately. So thank you very much and have a good day and have a good night. Thank you very much.